as you may know, St. Louise Hospital received 6 gunshot wound patients earlier this evening. 2 of those patients were transferred here to Santa Clara Valley Medical Center. One of those patients, sadly, is deceased. Of the 3 remaining patients, a little bit of good news, 2 of them have been discharged. So they are discharged. They were treated and discharged. Santa Clara Valley Medical Center, in addition to the 2 transferred patients, has had received another 5 gunshot wound patients directly from the scene. Of those 5, 1 has been discharged. So we're still treating the other victims. Our staff has been doing a great job. We had so many calls from staff coming in, just showing up or calling to come in and help tonight to be able to care for these patients. That's the news. We've been able to discharge a few people tonight, so they're home. They're going home.
Can you talk about the extent of the injuries?
So at St. Louise Hospital, 1 patient remains in serious condition. At Santa Clara Valley Medical Center, the patients are still, the rest of them are still either in critical, serious, or fair condition.
So originally, when we talked about this, 2 had been transferred here, so you had a total of 7 gunshot wound victims here in San Jose.
Right.
Can you just go over again, one of those 7 has been discharged?
One of those 7 has been discharged,
and
correct.
The other 6 are still in?
The other 6 are still in the hospital in fair to critical condition.
Can you tell us about their gunshot wounds? Where have they been?
I cannot give you any particulars about their gunshot wounds. Some have required surgery, and I think some are in the operating room as we speak.
And are all gunshot wound victims?
All the ones here at Santa Clara Valley Medical Center are gunshot wound victims. St. Louise, in addition to the initial 6 gunshot victims that they received, they have now received another 8 people with other types of injuries.
Less severe than a gunshot?
Less, like, I know one was a broken ankle from running from the scene and falling, so those kinds of scrapes, bruises, falls, other kinds of injuries from the scene.
Did you say somebody at this hospital died?
No, the person that died was at St. Louise.
So that's a total of 15 non-gunshot victims being treated.
No, 8 non-gunshot wound victims total, all at St. Louise Regional Hospital.
So they've talked about more people dying. Do we just assume that they were not brought here?
Correct. They were not brought here.
Or St. Louis?
Or St. Louise.
Do we know an age range of the victims at this time?
I don't have those particulars.
And you're telling us that most of the people that are here, they are in critical condition?
They range in conditions from critical to serious to fair. So there's different levels of condition.
All 6 of them?
Yes.
And the person that was discharged, what did they have?
Well, I can't give you any particulars about a patient without their consent. And so I can just say when somebody's discharged, the condition before they get discharged is called good. So they were in good condition before they were discharged. Anything else?
As far as the people in St. Louise, any particulars you can give us as well?
I cannot provide any information but condition of patients. That's it.
What about the range of age?
I think that I don't have all the ages, so it's hard for me to tell you the range of age. But we had a bunch of different ages, from young people to 20s to somebody 50 and older.
You have a
young children, little children, or
I don't have their specific ages at this time. I'll probably have more of this tomorrow. I don't know that I'm going to get a lot more tonight. And I don't think the patient's situation will change tonight. Anybody who's here now is going to stay overnight. So we probably won't have another update for you until tomorrow.
When was the last time your healthcare system has had to work with so many patients from a mass shooting like this?
Well, never from a mass shooting. We've never had a mass shooting in Santa Clara County. We've had multiple patients from other sort of emergencies. Most often a hazmat incident. We get a number of patients, but this is just a tough situation for our community, for our staff, for the families and the victims. It's just awful, and for hopefully I'll never see another one of these again, but you know, it's hard to tell.
Ready for this, or was there a
You know-
call while we waited for personnel?
No, we're since we're here, we're an emergency department and a trauma center. We're really well staffed to treat the most serious types of injuries. And like I said, our staff did a great job of either just coming in or calling in to come in and help. So we had no delays, we had no staffing issues. That was all handled very well and professionally by our team.